are, that's exactly like the pleura. Right? Same structure, same names, changing pleura for pericardium. In the parietal pleura was attached to the chest wall and to the diaphragm. In the heart, the parietal pericardium doesn't really have, it has a portion that's attached to the diaphragm, but there's really no other chest wall structure that it's fused to. In its environment, because the heart wall is made of muscle, if we overstretch it and the actin and myosin don't overlap, we've lost our ability to contract and force blood out. And so an additional layer of connective tissue is added to the parietal pericardium. There's another layer of dense, fibrous connective tissue. Instead of loose connective, it's dense, irregular. So I'm going to use the same color, but I'm going to add extra bundles. And this adds a toughness to the parietal pericardial layer. Right? So I don't have much room to write over there, so I'm going to put parietal pericardium. Well, I can put it here this way. So the epithelium is still going to be simple squamous. And now we have two layers of connective tissue. We have loose, irregular, and we have dense, irregular. So that creates three different terms for our pericardium. Instead of just visceral pericardium and parietal pericardium, all right, we now talk about a serous, and this, you can put the serous before or after the word visceral. A serous visceral pericardium. Okay, and that would be this structure here. And then we have a serous parietal pericardium. And that would be the identical component here, which is just simple squamous and loose irregular. And then we have a fibrous parietal pericardium, which is the dense, irregular connective tissue. So the serous pericardium is formed of simple squamous, and loose irregular. The serous parietal, the same thing, but not attached to the heart. Fibrous is dense, irregular. And we're doing a heart dissection today. So you'll be able to see that, but I want to show you an illustration on the screen. Because it can be a little bit difficult to see how that actually works, but fortunately, well, with the preparation of sheep hearts, they've been, agricultural laws have changed. And so they started stripping off the pericardium, the parietal pericardium. And last year, the hearts that were really small still had it on it, the real fetal hearts. The larger hearts did not, so we'll have to see what we get. Now, to add further complication to these terms, or to simplify it, depending if you have a silver lining to your cloud, a more simple name than serous visceral pericardium is epicardium. So for a lab exam or a lab quiz, if I touch the surface of the heart, so I'll show you in just a moment, You can either use the short-term epicardium, or you can call it the serous visceral pericardium. Let me guess which one you're going to choose to use. So just touching the surface of the heart. Okay. So let me bring down, if you're okay with that, let me bring down the screen and I'll show you an image of this. In the wintertime, when I'm wearing a coat, I try to illustrate it with a jacket, but I spent a few minutes in my closet this morning trying to figure out if I had one that would work, and I decided not to. Because we're doing the sheep heart dissection today rather than in a couple of days, and we'll see how this works. All right, so this is an open heart surgery. The lungs are shown above and below the heart. The pericardial sac has already been opened, and you're looking at the visceral serous pericardium or epicardium. All right, so here's lung tissue, and this is heart. Let me turn the lights up. Now the next slide, this is not a human heart, but I think it gives a better example, and I sometimes use the same image on the lab exam. So here is the pericardial sac on the outside. It has a lot of more adipose tissue. This would be the fibrous fibrous parietal pericardium, or you could say parietal fibrous pericardium on the outside. That sac has been opened up, so this would be the pericardial cavity all in here where the fluid is located. And now if you're touching the surface of the heart, you are touching the visceral serous pericardium. Okay? So again, if I'm the heart, and this shirt is the visceral serous pericardium, to be completely analogous, the lining of my sweater should also be the same fabric. That would be serous pericardium with the visceral attached to the body and the parietal attached to the outer pericardium. And then this tougher outer layer would be the fibrous parietal pericardium. Okay? So on our models, the surface of the model would be where the visceral serous pericardium, and we don't have parietal in any of our models, but you can see it on the chart. Now, typically we have just a little bit of serous fluid in that space. If any additional fluid or blood fits into that space, it's going to interfere with how much the heart can expand. And you remember Steve Irwin had the stingray embed in his pericardium. There was another incident where an older gentleman off the coast of Florida had a stingray land in his boat, and a similar accident occurred, but instead of pulling out the stinger, he motored to shore. So if he had pulled that out, blood would have probably escaped both the pericardial cavity and into the thoracic cavity. But if this space fills up with blood or fluid, it causes the heart to get smaller and smaller. So every time the heart beats, it's pumping blood into this space, and then it can't expand as much. So that causes heart rate to increase. There was an incident 2 years prior to my joining a local hospital here when I was in graduate school. I worked as an RN. And a young woman who was pregnant had come in with pneumonia, and she wasn't able to keep anything down, and so they started a subclavian line, which is a large diameter needle cannula that was placed in her subclavian vein right under the clavicle to give her additional pre-digested food. Well, she'd get worse and worse, and her heart rate was getting really fast, and along with that and the pneumonia, she wasn't getting good oxygenated blood, so they finally took an x-ray. And instead of having the cannula in the subclavian vein, the cannula had passed through that and entered the pericardial cavity. So all the fluid was going into her pericardial cavity. That condition is known as cardiac tamponade. So excessive fluid in the pericardial cavity. Okay, before we actually look at the structure of the heart, Can I slide this over to cover the mediastinal cavity component? Now we've looked at the outer wall of the heart, which is the pericardium, right? So the let me just use the term epicardium, so you know exactly which pericardium I'm talking about. So the epicardium is the visceral pericardium, which just creates a lubrication for its movement. We have the major component of the heart wall, which is the myocardium, and this is cardiac muscle. Innervated by the autonomic nervous system. Okay? So sympathetic nerves are going to increase heart rate and contraction force. And parasympathetic nerves, and what parasympathetic nerve would that be?
Vagus.
Vagus. Are going to do the opposite. Going to decrease heart rate. There are no receptors for the neurotransmitter, so they don't really affect contraction force. And in the lining of the heart, is known as endocardium. So this is also a serous, well, it's actually a mucous membrane, but it has simple squamous epithelium and loose irregular connective tissue. So this would be seen inside the chamber of the vessel, of the heart chamber, or rather the chamber of the heart. So if I were to touch the lining of, say, the right atrium, I would have to say identify this layer of the heart so that you would know I wanted endocardium instead of right atrium. Okay? So questions will be identify the layer of the heart, or identify this chamber, or identify the structure, those little notes up on the dividers or on the questions of the lab quizzes, so you know specifically what structure is being indicated. Okay, now let's look at the actual heart. The heart's purpose in transporting blood is a dual circuit. So the heart is transporting blood, receiving blood, and then pumping blood to two different locations. So after the baby is born, instead of the uterus and the maternal blood being the source of oxygen, it is now the baby's own lungs. All right, so the blood flowing to the heart is going to be oxygenated or deoxygenated. Deoxygenated. And the blood coming back from the lungs is going to contain the oxygen. Okay? So we have a left side of the heart and a right side of the heart. And then we have upper chambers and lower chambers. The right side of the heart is receiving and pumping deoxygenated blood. So that is all going to be deoxygenated blood. And deoxygenated blood going out the heart to the lungs. Okay? So everything on the right side is deoxygenated. Everything on the left side is receiving blood from the lungs and then pumping it to the body. So we have oxygenated blood. That's not what I wanted to. We have oxygenated blood. Coming in from the lungs and being pumped out to the body. So the left side is oxygenated. right side is not unoxygenated, but deoxygenated, about 40% oxygen instead of 100. Of what it normally transfers. Chambers are pumping chambers. So let's look at the receiving chambers first. The receiving chambers are the atria. The right atrium, we indicated on the diagram already, it receives deoxygenated blood, and it receives it via 3 vessels. Okay. So coming from the head, neck, and upper limbs, we have the superior vena cava. Deoxygenated blood from the head, neck, upper limbs, and chest. Transporting blood from the lower extremities and the abdomen, we have the inferior vena cava. And we'll be looking at these vessels, veins on Monday, arteries on Wednesday. Now, there's one organ that we've left out. I said chest, it is everything in the chest except the heart itself. Okay? So there is an opening, all the veins of the heart come together and join to form one long channel, and that empties into the heart just near the inferior vena cava, and that is known as the coronary sinus. The left atrium, remember, is receiving oxygenated blood. And so that is blood coming back to the heart. Now, we haven't talked about blood vessels yet. We'll start that on Wednesday. But blood that is returning to the heart, will it be under low pressure or high pressure?
Low pressure.
Where's the source of the high pressure? Our pumping chambers. All right, so if blood is flowing back to the heart, it has to be under lower pressure because it's a blood pressure gradient. So, blood vessels carrying blood back to the heart are carrying a low pressure fluid, which means they don't need to have as thick amount of smooth muscle. And by structure and function, we call those veins, no matter whether they're carrying oxygenated blood or deoxygenated blood. All right? So because these vessels are carrying blood back from the lungs, they are considered to be pulmonary veins. Now, it seems weird because our veins are normally blue in color when we diagram them on a piece of paper. But because these are coming back to the heart, they're under low pressure, they're veins, no matter what kind of blood they're transporting. So it receives oxygenated blood, and the vessels are pulmonary veins coming from the right and left lungs. So let's name our chambers here. Right atrium. Now you're not seeing much of the left atrium here because most of it is on the posterior side of the heart. All right? But what you are seeing is identified as the left atrium. Part of it.
It says in your reflection it's that it receives deoxygenated
From the left
blood.
atrium?
Yeah.
Okay, on the left, that would be wrong.
That's wrong.
So on your online notes, left atrium receives oxygenated blood. Now there's a small part of each atria known as an auricle. You'll see it on the sheep heart. It looks like a little bit like a cauliflower, an ear that has kind of petals or folds to it. And within those auricles are a series of cardiac muscle ridges known as pectinate muscle. So both the right atrium and the left atrium have pectinate muscle, and I will show that to you on the overhead in just a moment. But I want to put it here on our list. It really has no necessary function in creating a force or pressure in the atria, but it is an identifying structure. The rest of the atrial surface is smooth. So pectinate muscle, I just described as ridges of cardiac muscle. You'll see why when we look at their surface. I really haven't drawn the auricles on this diagram, so I haven't put it there. Then we have a remnant of a fetal structure. We'll look at fetal circulation a week from today. And this is because of the lack of oxygenation in fetal lungs. Not all of the blood in the fetus needs to go to the lungs. It's been oxygenated in the placenta already. So when the blood is returning to the heart, we don't need to pump all of it to the lungs. And a lot of it is diverted. Most of it is diverted to the left side and bypasses the lungs. So in the interatrial septum, the wall of muscle tissue between the right atria and the left atria, is an opening in the fetus. That as the great force of blood coming up the inferior vena cava is shot into the right atrium, it hits that interatrial surface and passes into the left atrium, and most of it just automatically avoids the right ventricle. This is not really a doggy door type of structure, but similar to flaps. As the atrial walls grow, they do this. And so there's a gap between the two. After birth, when the pressure changes, cause that pressure difference that keeps that open to disappear, those two surfaces grow together. Okay? So in the fetus, this opening is called the foramen ovale. And it's seen as a thickened oval ring. It's easier to see on the right side, but it's also present on the left. And so this structure is known in the adult, or after the baby is born and it closes together, as the fossa ovalis. So again, I'm going to put a star beside it because it's easier to see on the right side than it is on the left side. But the same structure, not two different structures, the same structure is present on both. And we have some plastinated cow hearts at AR. When you hold them up to the light, you can see this oval shape where the wall is thinner. Depending on how you cut your sheep heart today, you may or may not feel that thickened ring. So now, blood at the same time is passing into the right atrium and passing into the left atrium. When the heart is at rest, the blood continues to flow through the atria into the pumping chambers, which are the ventricles. Right. You can see I've drawn these flaps. There are two sets of valves that are open during this time and allow the deoxygenated blood to flow into the right ventricle and allow the oxygenated blood to flow into the left ventricle. So these valves, may I erase what's on the board here for the atria? Okay. So the valves separate the atria from the ventricles. And these are called sorry, let me change that, it's not atrial. ventricular valves. So you can either learn them as right atrioventricular valve, abbreviated right AV, but remember for lab and quizzes and exams you need to spell the whole thing out, and left atrioventricular valve. Or because of the number of leaflets differing on either side, the heart sits on the left side of the thoracic cavity more than it does on the right. This can also be known as the tricuspid valve. And this one has another, could be known as the bicuspid, because it has two leaflets. Or those two leaflets reminded somebody of a Catholic bishop's mitre, and so the other term is mitral valve, the most dreaded phrase in anatomy, also known as. But the reason I put that up there is clinically, you'll see the term mitral valve used in mitral stenosis or mitral valve replacement, and that's more common than left atrioventricular valve. Now, these valves are open at rest. And why are they open? Back to the magic word, pressure. So the pressure is greater in the atria than it is in the ventricles with the returning blood when the heart is at rest, and that keeps those valves open. All right? When ventricular pressure increases as the ventricles start to contract, and a smaller chamber for the same volume of blood increases pressure, the blood wells up under these leaflets, and they're hanging down into the ventricles, and that pushes the valves closed. All right? So the valves will close when ventricular pressure is greater than atrial pressure. Now notice we're still maintaining deoxygenated blood on the right side and oxygenated blood on the left side. So now the left ventricle right ventricle will contract as it is triggered to do so by the conduction system of the heart. And the left ventricle will contract. And as they do so, it's going to close the valves and now move blood out of the heart itself. So let's look at the structures of the ventricles and what structures regulate the tension of these valves. Can I cover up these words? I'm not going to erase them, just want to cover them up. Now we have pumping chambers. We have the right ventricle. And the left ventricle. The right ventricle is going to pump deoxygenated blood to the lungs. And it's going to do so by pumping through pulmonary semilunar valves. And those are located right here. The left ventricle is going to pump oxygenated blood. Remember, it received oxygenated blood from the lungs via the atria. So it's going to pump oxygenated blood to the body. Through aortic. Now it's hard to see the aortic valve because that is often hidden up. The aorta comes out the middle of the heart. And so it's often hard to see actually the actual heart or in the model. Okay. So now before we talk about the vessels that the blood is going to by passing through the valves, let's talk about the structures of the ventricles, and they have the same structures, just different amounts for almost everything. The valves that we see here, because they're under great pressure, have strands of collagen fibers attached to them. There are actually 3 valve leaflets on the right side and 2 on the left, but I'm only showing 2. And so as the ventricle is contracting and extending that great amount of pressure, force, to push the blood through the body or to the lungs, those valves, which are hanging down inside the ventricles, are going to start to move up like this and bulge towards the atria. And without those strands of connective tissue that I drew, they could actually turn inside out and allow the blood to be pumped back into the atria. So these strands of connective tissue are known as chordae tendineae. They are present on both the left and the right side. And they are adjusted, their tension is adjusted by small muscles that arise out of the wall of the ventricle. And somebody thought they looked like small mammary glands. And so they are identified as papillary muscles. Their function is not to close the valves, but to adjust the tension. The pressure of the blood is what closes the valves. So both right and left sides will demonstrate chordae tendineae and papillary muscles. Now the surface of the ventricular wall also has cardiac muscle ridges, the entire ventricle, instead of limited to the one area like it is in the atria. And so those are called meaty shells or meaty surfaces. And we use the term trabecular cardium. Every time I write that, I think of the lion in the Taco Bell ad, talking about the meat, the burrito. So now as the ventricular contraction increases and the pressure closes those valves, the pressure rises very rapidly because we're in a closed system, and the pressure rises higher than the pressure in the pulmonary trunk or the aorta, and the semilunar valve will open. If we come back to this chart here, and we have our semilunar valves, and you do not need to include the term semilunar valve. You can just say aortic valve or pulmonary valve. If you use semilunar, then you need to indicate that it's aortic or left, or pulmonary or right. So you could say right semilunar valve, or you could just leave it at pulmonary valve. Okay? So the pulmonary semilunar valve is going to open to allow blood into the pulmonary trunk, and the aortic semilunar valve is going to allow blood into the aorta. These are closed at rest when the ventricles are resting, because aortic pressure is higher than ventricular pressure, and they open when ventricular pressure is greater than aortic pressure, or pulmonary trunk if we're talking about the right side. So this vessel that the blood is flowing into right here is the pulmonary trunk. And it branches to form right pulmonary arteries and left pulmonary arteries. Notice whether these arteries are carrying deoxygenated blood, because they're under high pressure and they're carrying blood away from the heart. So even though they're carrying deoxygenated blood, they're known as arteries. Okay, so the term artery or vein is used in whether the vessel is under high or low pressure. High pressure because it's carrying blood away from the heart. Low pressure because it's carrying blood towards the heart. Okay? So let me put some arrows in here just to help you recognize that. So now when ventricular pressure is greater than pulmonary or aortic pressure, these valves will open and the blood will flow out to the lungs from the right side and to the heart from the left side in the aorta. All right, now I want to show some images of the heart that are a little bit more three-dimensional than I can take the time to draw. And then, of course, obviously we have the models in the sheet for us to look at. We'll do the blood vessels of the heart in lab. Okay, so the arteries and veins of the heart will do in lab where you can actually see them. I could diagram them for you, but you wouldn't learn them until you got to lab anyway. So this first one is just a diagram of the whole heart, kind of cuts in view, well, without being cut yet. So down here at the bottom, notice how the superior and inferior vena cava form a straight line. Unfortunately, with the new way of harvesting the hearts from the fetal sheep or the adult sheep, they cut really close to the surface of the heart, and so if it's the same as last year, very few of your hearts will actually have a superior vena cava. It'll probably be cut open the surface of the right atrium. But blood, this would be superior vena cava and inferior vena cava. So in your online lecture notes, I talk about the surfaces and borders of the heart. So the right side of the heart is formed by the right ventricle primarily, actually right atrium, more right atrium than right ventricle. This diagram doesn't show quite as much of that, but right atrium. And the inferior border is formed by the right ventricle. This vessel right here is in a groove that separates right ventricle from left. So the left border of the heart is formed by the left ventricle. This area right here is under the sternum. Okay? So you can see how most of the heart is on the left side. And then the posterior surface of the heart, which you'll see a little bit later, is formed by the left ventricle and most of the left atrium. So here we have blood from the head, neck, upper extremities, chest coming in from the superior vena cava into the right atrium, and from the abdomen, pelvis, and lower extremities to the inferior vena cava. This opening right here is the coronary sinus. At the same time, blood is coming from the pulmonary veins into the left atrium, into the left ventricle, and these openings are the pulmonary veins. Here are the right and left ventricles. And then when the ventricles contract, blood goes through the pulmonary valves into the pulmonary trunk, through the aortic valves, which you barely see here, into the aorta. So now this next image, these are from Netter's Atlas, and then we're going to kind of look at the view of one chamber at a time. In the sheep heart dissection today, you can make these kind of flaps into the chambers, or you can cut the sheep heart completely in half, okay, and have two halves that you look at. So in this view again, you're seeing the straight line between superior vena cava and inferior vena cava. And here is the pectinate muscle I talked about, okay? It's going to be found just in this auricle-like structure. The rest of the right atrium is smooth. Right near the inferior vena cava, we see the opening for the coronary sinus. Here is the fossa ovalis. The fetal term is foramen ovale. Adult term is, or after birth term is fossa ovalis. Here is some of that pectinate muscle in the sheep heart. So you can see it's an isolated area that we call the pectinate muscle. We look at the left atrium over here, and we just have the openings for the pulmonary veins. And here you can see the fossa ovalis as well, but not as clearly. Again, it's a little bit thicker and easier to see on the left side, and a little bit of pectinate muscle in the left auricle. And here's some more of that pectinate muscle. And you can see the light region where the fossa ovalis is located. This is sheep heart, and this would be the left ventricle here, showing the trabeculae carni and some of the papillary muscles. So let's look at that ventricular structure. Going from the right atrium into the right ventricle, we have the right atrioventricular valve, one leaflet, second leaflet, third leaflet, and you can see how the chordae tendineae attach to these papillary muscles. This would be the trabeculae carni here. So it completely surrounds the structure of the ventricle rather than being isolated. In the sheep heart, you can also see this band right here, which is really not papillary muscle. Not in the models, but you can see it in the sheep heart. It's a part of a conduction system carrying electrical signals over to this papillary muscle, known as the moderator band. Some it will be very thin, and others will be robust, like you see in this image. Now, as we look up out of the right ventricle, notice how the pulmonary trunk is arising out of the surface of the right ventricle. So these are the pulmonary valves right here. Three little sconce-like cusps. And they close when blood backflows through the pulmonary trunk or the aorta. On the left side, we have only two leaflets. So we have only two sets of papillary muscles, and we still have the trabeculae carni. So if you look at the sheep heart dissection here, this would be papillary muscle right here with the chordae tendineae, and here's the aortic valve leaflets right here. One thing I want to show you before we get to lab is right behind the leaflets of the aorta, we have the openings for the coronary arteries. Okay, those to the heart is the first branches to the heart get the blood supply. However, the blood to the coronary arteries fills when the heart is at rest. Because when those valves open up, they close, they cover off the coronary arteries. Which makes sense, because if we have the coronary arteries going into the muscle, and the heart's contracting, it's going to be squeezing those blood vessels going down into the ventricular muscle. So it makes sense that the best blood flow is to the heart at rest. Okay? What happens when you exercise to your heart rate? It goes up. The period of rest decreases. So right at the moment when your heart needs more oxygen, there's less rest time for blood to flow. So that's why you need lots of blood vessels within the heart, so it gets to it quickly. And that's why people have chest pain or angina when they exercise if they have narrowed blood vessels. Okay, so a lot, hold